126, right? You took the 12.
see what's up. I go to yeah.
All right. And I sent him for Nigeria, I asked PS to fast track it. If I can get all yes, that is no, I mean, based on what we already have, I'm not going to ask for the more. I'm not going to ask for the more. It will be what we already have. Try to share with Alexander's phone. Yes, that's what I was thinking. Yes, it's whatever because I just put for private. And tomorrow they will be there. But actually, that's what somebody else I was thinking you could use to get them to the 10 days first. Yeah. As long as they get back to the can walk in. And they check their woman because
For now, you'll sit by me.
Okay.
And then once you're done, you can move down to leave the seat for when the PM comes. So for now, you can sit there since you're going to present first. That's let me talk to both of you. Come on. You don't have to bring your stuff. I just want to talk to both of you. You're not. Sure. Okay. So the PM is joining us. We're going to let the minister present first, and then you'll go after him. And when the PM comes, you'll present.
No problem, because I go second.
Yes. So, like I said, this seat, when I'm done with introductions, this seat will be empty.
Okay.
So
And then I come across.
right here, just come up here, because I'll get up and I'll do sit back here.
I don't move the mic. So
No. Good. Okay.
That's
For me, yes. That's for me, Pastor. Okay. I can wait. Minister, you need a laptop?
No.
Okay, so good morning again. Before we get officially started, we are going to begin without the Prime Minister, and then he will join us when he's done. Okay? So for the media, we will be opening the floor to questions following the presentations. I'm sure many of you are happy about that. All right, so prepare your questions, and remember, it will be after the presentations. Okay, if the Prime Minister is still not there, we'll do it in between while we wait for him. You good? All phones off, silent, please.
So, take your seat or I'll just...
You can stay to do your presentation from there. Once you're done, then you can move down. Okay. Chad, you'll let me know? Okay. Good morning, everybody. And thank you for joining us for this COVID-19 update. A little bit of a different twist to what we usually do, but we're hoping that this method, this new strategy, will be more engaging for those listening. I'd like to recognize the presence of the Acting Minister for Health, Wellness and New Health Investment, Honorable Kent Edwards. Also with us is the Permanent Secretary within the Ministry of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke. The Acting Chief Medical Officer, Dr. Laura Esprit. Principal Nursing Officer, Terelia Ravalier, on the other end of the table. We have with us, as you may have noticed, other heads of department within the Ministry of Health, Wellness and New Health Investment. Of course, they are making themselves available to answer any questions that you may have. And I'd like to welcome our media partners. Thank you for making this broadcast possible. The listening and viewing public, good morning. The order of our briefing today will have a presentation by the Acting Minister of Health, Wellness and New Health Investment. Again, that's the Honorable Kent Edwards. That will be followed by the Acting Chief Medical Officer, Dr. Laura Esprit, and then we will be joined by the Honorable Prime Minister, who will be doing a presentation as well, and we'll be opening the floor to questions from the media. So I'd like to welcome, first off, the Honorable Kent Edwards, Acting Minister of Health.
Thank you. Good morning, everybody. The Ministry of Health, Wellness and New Health Investment have put several programs in place since the COVID-19 pandemic. And today we are here, and I wish to inform you that the Ministry of Health is by extension to the government of Dominica put a program to implement the vaccination of the public in terms of the COVID-19 pandemic. Consideration has been given to the following aspects, among others. We have identified the target groups. We have put human resource management in place, training of staff, communication, information, social mobilization, and other logistics. They all have been put in place, awaiting the execution of the vaccination of the public against COVID-19 pandemic. Because as we know, COVID-19 is caused by a virus, and the only way that we could curtail the spread and put our people back on healthy and allow the world economy to continue progressing is by vaccinating the public and acquiring immunity towards that virus. And we have priority target groups that we have also identified: the frontline workers, health workers, and other frontline health workers, persons with chronic diseases. As we know, there are several people with chronic non-communicable diseases among us, hypertension, heart disease, and others, cancer, and persons 65 years and over. We already know that the elderly are more vulnerable than our normal population. That's why people 65 years and over are a priority group in this. There are other vaccines, and many vaccines, I should say, available globally. But the Ministry of Health, Wellness, and New Health Investment, and by extension, the government of Dominica, will be making available the AstraZeneca vaccine. And as you heard last night, the Prime Minister, on his program, announced that he will be getting 35,000 doses, and logistics are already in place to implement the vaccination of the population. And this will include a supply chain management, transportation arrangements from the Douglas Charles to central medical stores. Thereafter, vaccines will be distributed across the islands at various points, across the islands, sorry. The actual rollout of the vaccine will occur at the level of the primary healthcare services, and a detailed primary healthcare plan is currently being finalized by the ministry. Additionally, and very importantly, a comprehensive communication plan has been developed and will be implemented in order to sensitize the general public on the vaccination of the people. Morning. So we are putting in place a communication plan where the Ministry of Health staff and other people will be going to the communities and informing the public, educating them, telling them exactly where the vaccination will take place, how it's going to take place, and who is going to administer it. In 2020, the ministry conducted a survey through the Health Promotion Unit to ascertain the public's view and the willingness to take the vaccine. However, there will be further opportunities to have the public do so in the coming days and weeks. The Ministry of Health plans to begin this vaccination, as I said, as soon as the vaccines arrive on island, and we know that the general public is looking forward. We know that it's a voluntary process, but we are asking people to get themselves immunized against this dreaded disease. And we are looking forward to everyone's cooperation. Thank you.
Our thanks to the Honorable Kent Edwards, who is the Acting Minister of Health, Wellness, and New Health Investment. I would like to recognize the arrival of the Honorable Prime Minister of the Commonwealth of Dominica, Honorable Roosevelt Skerritt, and we would like to invite him to make a brief presentation this morning. The Honorable Prime Minister.
Thank you very much. Let me recognize my friend and colleague, Honorable Kent Edwards, who is the Acting Minister for Health, and for the Permanent Secretary and the staff of the Ministry of Health, the media, and the citizens of our country. This is the beginning of our extended engagement to the public, to share with the public the information and to educate the public and to sensitize the public in respect to the vaccination program for Dominica. As the Minister indicated in his statement, this will be a voluntary offering. It's not meaning that it's not mandatory. Those who wish to take it will avail themselves to the health authorities. The Ministry of Health will indicate the first categories of persons who they are recommended to be vaccinated, and so we will start with these categories. But also say to us, on the issue of the vaccines, of course, there's a lot of talk, and rightly so, about the vaccines. But it's important for us to pay particular attention to authorities on these things. We will read a lot of stuff on social media, on the internet, and so forth. But we always have to question the sources of this information. And all these conspiracy theories on both sides of the continuum, you know. But the reality is, at some point, I believe, if we do not see the spread of the virus going away rather, and with the new strains of the virus coming on stream, as we see in South Africa, United Kingdom, in Brazil, and so forth. The reality is, we may very well need to show that we've been vaccinated to travel. That might become a reality sooner rather than later. We've heard airlines. I mean, I believe Qantas, the Australian airline, has indicated that they'll be moving in that direction. To go to certain parts of the world, even prior to this, to the outbreak of COVID-19, you need to get certain particular shots if you're to travel to some countries in the world. Of course, to protect yourself, and also to protect the countries that you're visiting. And you must take these shots before you can board a plane. You have to show that you would have taken those shots. And of course, there's been a historical view and concern about vaccines. This is not the first vaccine that has been developed. And people have a right to question and to determine for themselves whether they would take it or not, and so on. But we have to listen to the science and the scientists on this. And that's what I am doing myself, personally. As I've indicated to the public, I will avail myself to be vaccinated. I will not jump the queue, so I will wait my turn in terms of the recommendations of the Ministry of Health, because I don't want somebody to say, well, Scary came and there was only one and Scary took it for himself, you know. But I'll certainly avail myself to be vaccinated. What we have done, we have been working through both bilateral and multilateral arrangements to ensure that in Dominica we can have sufficient vaccines to offer our population. We've been working through the multilateral network of Covet, through CARICOM and with the Pan American Health Organization, and there's a commitment there for 20% of the to cover 20% of the population. And this was done knowing that the vaccines will be used up by the developed countries where these vaccines are developed in large measure to offer to their citizens first. And that's the reality of life, and and one cannot condemn a nation for behaving that way. But we've been calling for vaccines to be declared as a public good, meaning that it should be accessible and available to every nation, rich or poor. When you look at the news, they're saying that in Africa, for example, only 3% of the population may be vaccinated, and it'll take about 3 years or so. And this should not be the case. We should ensure that nations all over the world, including in Africa, would have access to sufficient vaccines to provide to the populations. And we've seen what happened in parts of the world where they have put a ban on the exportation of vaccines because there were concerns about their own countries not getting sufficient vaccines and so forth. So there's been a lot of discussion about this, and this is why through the PAHO arrangement and COVAX and so on, we were working on this multilateral approach to ensure that the Caribbean region could be assured of some quantities of the vaccines. And we are grateful for this arrangement. Every country in CARICOM will certainly benefit from this, and the different tier system. But recognizing from the government standpoint too that we will need to ensure that we could get to a point where we could have vaccines to offer to the whole of the population. We've been working on bilateral arrangements. Now, obviously, the use of those vaccines in Dominica, we would have to be guided by PAHO and CAFA, and also WHO in terms of the use, and we continue to be in touch with these organizations. And as we announced, the government of India has made a grant donation of 70,000 doses, but that will be for 35,000 people because there will be double doses and so forth. So there will be 70,000 doses of the vaccines. That would cover 35,000 people in our country. We expect the vaccines to land in Dominica tomorrow, Tuesday, and it will be left to the Ministry of Health. I know they've been fine-tuning the vaccination plan, and this is part of the process to start sharing with you this plan. But I wanted to stop by and to share with you the sentiments of myself personally, and of course the sentiments of the government in respect to the vaccines. So I am not going to spend much time myself trying to persuade people against their will from taking the vaccines. I'm not going to engage myself in any public debate about this thing. Who want to take it, take it. Who doesn't want to take it, then don't take it. But if we want to know more about the vaccines, if we have certain reservations and we want additional information to satisfy or to address our reservations, which is natural for people to have. It is something new, and you're hearing so many things, and people will have questions and doubts, and this is natural. Then this is how the ministry will be availing itself to inform and educate you. So it's important for us to ask the sensible questions, or any questions for that matter, that we may have, that we believe to be sensible, so that answers can be provided. But people say about where the medication is being, where the vaccines are being developed and so forth, and what might be in it. But the reality is, we all take all kinds of medication that we never ask questions about. We don't ask our doctors about this medication. The doctor gives it to us and we say, how often should we take it, doc? And then the more medication we get, the more we keep them. So many of us even have small pharmacies at our home with medication that we have piling up and taking every time and so forth. So my comment is not to condemn anybody who would have reservations, but to say to you that avail yourself to the information that we provided by the health officials and so forth, and so that clarification can be provided. I think it's a wonderful opportunity for us to have access to these vaccines so early and so quickly, and we look forward to the usual efficient rollout of these kinds of interventions by the Ministry of Health. Dominica has a very robust primary healthcare system that has helped us in our fight against COVID-19, and especially for contact tracing, and this has helped, and we thank you, the population, for your usual cooperation. And also say before I leave that we can say yes, we only have 13 active cases now. It's 13, 12. Yes, we have on the books 12 active cases. They're all in isolation. But as we've said always, and I keep on to say, that we do not know whether we don't have COVID-19 at our homes and our business places on the streets. We don't know. Because there are always risks in this thing. No system is perfect. And we also have the illegal entry into our country, and you never know. Some countries in the Caribbean have been able to identify cases that they have had as a result of those activities. And the same thing could be the case here in Dominica. And this is why we have to continue to adhere to the protocols and to the guidelines. And especially that's coming up to the carnival season. We know for many people, you better kill them and leave carnival alone. So it speaks to the seriousness with which many people take carnival. But not having carnival activities, they say, won't kill anybody. And so this would help. Not having this kind of activities would help minimize the risk or the potential risk rather of spreading COVID-19 in Dominica. Their sister countries have a huge challenge, and we empathize with them. And we need to continue to take all the measures that we need to take, not only from the Ministry of Health standpoint, but from the standpoint of every resident and citizen of our country. That is important. So the protocols, we need to adhere to them. And people have asked, well, you have funerals and you have church service, why can't we have a fete? The reality is, when you're in a fete, I don't expect you to have a mask and be drinking. So always the view that you're more than likely not to be wearing a mask when you're in a fete situation, and you're more than likely not to be sanitizing your hand as regularly as you should, and you're more than likely not to be socially distancing in a festive environment. So these are some of the reasons why we and then when you're intoxicated, this is when you want to hug everybody and to speak in everybody's face as closely as possible. So this is why the festive activities are a concern to all of us, and this is why we are asking people to minimize your exposure to this kind of activities, to safeguard yourself, safeguard your family, and of course to safeguard the country. Thank you very much.
And our thanks to the Honorable Prime Minister Roosevelt Skerrit. Let me, on behalf of the Ministry of Health, of course, thank you again for your continued support and your very proactive and preemptive strategy as it relates to the vaccination rollout, and for making it possible that we can acquire some vaccines, some doses of the vaccine at the earliest time possible. So again, thank you to the Honorable Prime Minister. I welcome to the microphone next to the Acting Chief Medical Officer, Dr. Laura Esprit.
I have to leave. I'm not sure if you have any questions for me before I leave. Go ahead, please.
Sure.
This might be premature, but in a discussion with other regional governments, has the topic come up whereby it will be mandatory for us as Caribbean citizens to live vaccines to travel to other Caribbean countries? Has that come in discussions? And
Go ahead, please.
sorry, and the second question, on the topic of vaccinations, is there a possibility of the protocols for travel, that is the mandatory quarantine, when they arrive on island, would that be lifted or eased up for those who are vaccinated who enter Dominica?
Yeah, I will leave the second question to the health people. I know there have been discussions with the Pan American Health Organization on this, and there's some internal discussions on this, but I'll leave them to give you a more detailed response. There have been no discussions at the CARICOM level in respect to the vaccines and the mandatory imposition of the vaccines and letting that be a requirement of travel. I've been around for some time, and I believe it's going to happen naturally. The reality is countries want to get back to normal. And if there's a view that the vaccines can in fact facilitate countries getting back to normal, the countries in this world are reeling from this from the impacts of COVID-19, from a financial economic standpoint, the job losses and there's an increase in poverty levels, and businesses are being closed, and especially people in the tourism-related businesses. So if that's what's going to cause people to be able to travel again and to get back into schools across the world, I mean, universities are online, most of them. So as a result, significant losses for these universities. You may very well find, as I said, and there's been discussions from the airlines, interestingly, from the airlines, about making traveling with them, having been vaccinated being mandatory to travel with them. So there's going to be a cascading effect in respect to vaccines and who will be needed to be vaccinated, and the mandatory need to be vaccinated if you're to be mobile. This is not the first time this will happen. It happened many times before, and it will happen again. This is why I believe that it's important for us as citizens and residents of this country to avail ourselves of the scientific information, and be guided by our health professionals on this. I can only make a decision for myself in this respect, and for my family. But each of us has to make a decision for ourselves, and of course on behalf of our families and so on. But the key in this is to follow the science and follow the guidance given to us by the Ministry of Health. I think this is the authority that we should be listening to on this matter, and to determine at the end of the day whether we're going to take it or not. Yes, sir.
Yeah, that's an first question, actually two ones. The first one, like you said, we're putting people in quarantine. Are they going to be receiving the vaccine, like you said, it's a choice? And then the second one is, in respect to the statement that you made about we not being confident in speaking to our doctors, it was appreciated what stuff, like in this case, was speaking about that, being able to have a couple of conversations with your medical professionals. So my question is, will there be something like what happened with Social Security last week when they celebrated anniversary, where the video we put out was explaining the vibe, so you can put a video saying that it's the vaccine, this is such and such, but persons who may not be confident enough to ask the medical providers, would that be made as well as social media?
Yeah, I mean, I've seen the documents that have been prepared by the Ministry of Health so far, and I think they'll be engaging the public in a robust manner over a period of time. And there'll be lots of information. And this is just the beginning to start to sensitize the public on this, but there'll be such sensitization taking place on the various news mediums, communication broadcasting medium, and also in at the district level, and the various health centers with nurses and district doctors, medical doctors will be able to to avail themselves to provide education on the vaccines to the people. My sincere hope is that medical professionals would be able to educate us from a medical science standpoint. That is important, because in this country, as you know, sometimes people provide advice to us based on a particular bias, and not on what they've learned in school, or not on what they have researched from a professional standpoint. So I'm hoping that sanity and professionalism would prevail. Would prevail in this regard. And we provide the public with the most accurate information that we have. And I hope that this will prevail in the country. That's okay.
What you said, brought up another question, a suggestion. Is there a possibility of a team of medical professionals having like an overall platform where we have like doctors of different fields and genres having like a press conference on that matter?
I'll leave it to the Ministry of Health to decide. But from my standpoint, all this, what are you gonna say? I mean, the Ministry of Health has many other issues to deal with. Besides this one, we have CNCDs to deal with, to confront diabetes and diabetes-related illnesses, and hypertension-related illnesses. And also, it's something I think that the Ministry of Health has to preoccupy itself with in the country is there's accidents that we're having in the country, and the cost to the public health system of the census accidents that we're having across Dominica. And also there's domestic issues that we're having. There's a huge cost that is not really properly costed, but it's having a huge cost in the public health system. The other thing that we have to talk about. It's important for us to have debate, but a debate must have an end. It must have an end in sight, and I will leave it to the Ministry of Health to determine how they're going to go about dealing with that. Yeah. Okay. Yeah, but I think you should leave all the hard questions to the Ministry of Health. Give me some, So, yeah, go ahead, please.
The other questions. So 70,000 doses in the first instance. When can we expect to get more, or are you banking on herd immunity in this case? And what is the potential cost, I would guess, of these vaccines? You mentioned they were granted to us, but what would it cost people actually for these vaccines?
Well, the 70,000 doses that we're receiving from the government of India is a gift from the government of India to the government of Dominica and the people of Dominica. So we don't have to pay anything for this, and this is an extraordinary gift to us. And gifts really, there's no price tag to a gift. It is the demonstration of concern that really matters. The gesture, and such gestures. There's no price tag to it. I mean, it speaks to the relationship which exists between Dominica and India, and the way in which the government of India view Dominica. That through a simple request from a prime minister to a prime minister. And I can say to you, to the country, that I wrote to the Prime Minister of India, let's say today, and the following day I had a response from the Office of the Prime Minister, indicating that he's received my request, and that they will provide vaccines to Dominica, and so forth. So there's no price tag to it. That is for 35,000 people, and plus you have the 20,000, the vaccine that will cover 20% of the population. Obviously, we will not get the 20% all at once, but as time goes by. And then we are in discussions. The Chinese government has offered 20,000 doses of the vaccines from China. This is a matter that we discussed in the Ministry of Health. So I think if we can get all of this into the system, based on approvals and so forth, I think it will have covered a significant percentage of our population. And I believe in the next few months, if we're consistent with this, we can get the whole population of Dominica, if people are interested to be vaccinated, the whole population vaccinated. I believe way before summer of this year. But to be in a position in February to receive such a large quantity, I mean, we have to thank God for this. Yeah, and so the folks. Thank you.
All right, thank you to the Honorable Prime Minister. All right, so as mentioned before, our next presenter will be the Acting Chief Medical Officer, Dr. Laura Esprit. Some of your questions that you posed earlier, I did take note of them. So once she's done, then we will have one of the heads of department answer those questions, and then we'll open the floor to others as well. All right, so I welcome the Acting Chief Medical Officer.
To the Prime Minister of the Commonwealth of Dominica, Honorable Roosevelt Scarrett, or Acting Minister of Health, in the Ministry of Health, Wellness and New Health Investment, the Honorable Kent Edwards, our Permanent Secretary in the Ministry of Health, Mrs. Letitia Lestrade Wyke, the Principal Nursing Officer in the Ministry, Mrs. Terilia Ravalier. We have heads of department in the Ministry, other invited guests, the media, of course, our moderator, and the listening and viewing public. Good morning to all. This novel coronavirus has deemed this year 2000 as a year without precedent, extraordinary. Globally, inclusive the Caribbean, there has been massive economic and social disruption with consequential impacts on food security systems, employment, among other areas. Needless to say, both the public and private sectors suffer collectively, yet with unique challenges as they continue to face an existential threat. Worldwide, the COVID-19 virus has tested health system capacities, exposing inequalities and health disparities, derailing non-COVID related health and social programs, and causing morbidity and significant mortality. Dominica has not been spared the effects of this pandemic. Despite having 126 total confirmed cases to date, with 114 successfully recovered, 12 active cases at present, and 0 COVID-19 related deaths, our populace, like many others, is challenged with growing mental health concerns, unique COVID-related stressors, and of course, socioeconomic challenges. Over the period of 1 year, a series of new protocols and policies have guided our national response to this pandemic, with the support of a national technical committee and a dedicated ministerial subcommittee chaired by the Honorable Minister for Health. Various public health and social measures have been implemented to ensure that our health systems were not overwhelmed, despite being stretched with limited resources. These measures, we must agree, have proven to be instrumental in keeping the spread of the virus to a minimum. Whilst these measures cannot be overemphasized, the battle against this pandemic impels us to use another form of ammunition that is now available to us, which is expected to directly curb the surge of the virus, and that's the introduction of the COVID-19 vaccine in Dominica. One may ask, why do we need a vaccine against COVID-19? Well, vaccination is a safe and effective way to prevent disease, and it saves lives, no more than ever. Today, there are vaccines available to protect against many diseases, such as tuberculosis, diphtheria, tetanus, pertussis, influenza, and measles, and has saved lives up to 3 million people every year, according to the WHO statistics. When we get vaccinated, we are not just protecting ourselves, but also those around us, reducing the spread of the disease. COVID-19 virus, as we may know, is easily transmitted and can lead to long-term serious illnesses and death, even for people who are young and healthy. And so a COVID-19 vaccine is one important way to protect people from this disease. The COVID-19 vaccine is expected to help your immune system to identify and fight the virus. Now, is there a need to introduce this new vaccine to Dominica? Simply put, yes. And I hope to walk you through the many processes involved in the rollout or introduction of the vaccine, which goes far beyond the 5 to 10 seconds it may take for its administration. With regards to the justification for the introduction of any new vaccine, the Pan American Health Organization, references a model referred to as decision-making criteria for new vaccine implementation. The factors contained in this model divide the actual decision-making criteria into two groups. The first group embraces the political and technical factors, while the second group speaks to feasibility and scheduling. Due to time constraints, let's focus only on the first grouping. What is deemed political and technical factors essentially offers guidance to senior authorities about the advisability of introducing the vaccine from the standpoint of an evidence-based immunization policy and consists of 5 areas for review. And they are, number 1, the political and public health priorities, 2, the burden of disease, 3, vaccine safety, efficacy, and quality, 4, comparison with other interventions, including other available vaccines, and 5, the economic and financial criteria. Permit me to provide some insight into number 2, which deals with the burden of disease, and number 3, vaccine safety, efficacy, and quality, so that you can appreciate the quantum of considerations involved. Is there a significant burden of disease that merits the introduction of a COVID vaccine? Yes. As we are aware, the outbreak of the COVID-19 virus was declared a public health emergency of international concern and has spread to over 106 million people, claiming the lives of more than 2 million, whilst being spread at a significantly high rate. So despite Dominica having just above 100 cases, the aim of the Ministry of Health is to reduce the risk of transmission and increase the immunity of the public. With regards to vaccine safety, efficacy, and quality, we are aware that several vaccines are currently available on the market. Extensive discussions are held on vaccine characteristics, their efficacies, and that's just a big word to say their ability to produce a desired result. Clinical trials already conducted, the number of doses required, and equally important, the logistics of storage or cold chain capacity. So for example, our regular vaccines are usually stored at temperatures of 2 to 8 degrees Celsius. However, one of the vaccines have storage capacity of minus 70 degrees, or what is referred to as ultra cold storage. Hence, acceptance of any vaccine means that due consideration must be given to the logistics of storage equipment and transport. Of course, we want to avoid any type of wastage. With all these factors considered, to facilitate a satisfactory rollout of the vaccine, an implementation plan was developed, which was approved by Cabinet. This plan serves as a roadmap designed to document in detail the critical steps necessary to introduce this new vaccine into our population, with a step-by-step list of tasks, specific persons assigned, as well as timelines to help the team remain on track. With the overarching focus of reducing the risk for the spread of the COVID-19 infection in Dominica, the plan has 3 main objectives. Number 1, to identify the key population at risk for COVID-19 infection. Number 2, to ensure equitable distribution of safe, effective vaccines within the population for the prevention of the infection. And number 3, to define the logistics and infrastructure necessary for a successful rollout of the vaccine. Now, there is a tool which I wish to highlight at this point, and that's the COVID-19 Vaccine Introduction Readiness Assessment Tool. In short, it's called VIRAT, V-I-R-A-T. This tool was developed by the World Health Organization in collaboration with PAHO and other partners to be used by ministries of health to establish a roadmap and to monitor the progress in the preparation of the activities related to the introduction of the vaccines. The provision of a structured framework will enable self-monitoring of their readiness, the progress against key milestones, and ease of identification or identifying areas where technical support may be needed. Various parameters with over 50 indicators are being monitored. Based on the VIRAT submitted this month, February, compared to December, we have made significant progress as it relates to our state of readiness for the introduction of the vaccine. Some parameters highlighted in this VIRAD tool, which mirrors our detailed implementation plan, include the following: planning and coordination, identification of target populations, vaccination delivery strategies and timelines, preparation of supply chain management and healthcare waste, human resource management and training, communication and information focusing on vaccine acceptance and uptake, data monitoring systems, COVID-19 surveillance, and evaluation of COVID-19 vaccine introduction. Now, the intention is to vaccinate approximately 70% of the general public at minimum to achieve what is referred to as herd immunity, and we heard it a little while ago. But in the first instance, 26% will be targeted, referred to as our priority group, totaling a little more than 18,000 persons. The selection of this priority grouping for the first phase of the rollout is being guided by recommendations made from PAHO WHO advisory groups, in addition to the in-country COVID-19 profile, or national priorities, and of course, all the disease profile on island, like your diabetes, hypertension, and other comorbidities, considering those who are vulnerable and most at-risk populations for contracting and transmitting the disease. Now, you may ask, why prioritize who will be vaccinated? The reality is that right now, the supply-demand ratio of vaccines are disproportional, meaning there are not enough doses of COVID-19 vaccines for the entire population across all countries. That's the reality. Therefore, vaccines will need to be introduced in phases, and states are expected to prioritize the population to be vaccinated in the first phase. So similarly, it's like if something is in short supply in country, we would have to devise a mechanism to provide those who need it most to get it first, and subsequently to ensure that the rest of the population is covered. As it relates to priority groups for the administration of the COVID-19 vaccine, this will include the following. First, the frontline healthcare workers, and that would include doctors, nurses, ward aides, health aides, domestic workers, orderlies, lab personnel, x-ray technicians, pharmacists, dental personnel, environmental health officers, amounting to approximately 1,000. Other frontline workers to include the police, customs and immigration, fire and ambulance personnel, amounting to a little over 600. Persons with chronic diseases. This would include those with diabetes, hypertension, heart disease, cancers, respiratory conditions, the immunocompromised, including those on dialysis. That would be over 7,500. Persons over the age of 65 years, primarily the elderly population, and that would be approximately 8,900 persons. And of course, we have government officials, which would include, of course, cabinet members, ambassadors, president, parliamentary secretaries, and other persons within that group, officials, which would amount to approximately 100. Again, this will be done using a phased approach based on varied and individual circumstances. Now, why are frontline health workers among the first to be vaccinated? To some, it may not be obvious, but frontline health workers are prioritized for the following reasons. Firstly, they are at a high risk of being infected with COVID-19 and possibly at a high risk of complications of death. Secondly, there is also a risk that they can spread the COVID-19 virus to their patients who are also at high risk of complications. They work under intense and challenging conditions, and they put themselves at higher risk in order to help others as part of the COVID-19 response. And they are also considered essential in keeping the health systems running. A double-fold impact is that frontline health workers, they have an important responsibility to lead by example. That would be to their friends, family, and even co-workers or colleagues, as they are one of the most trusted sources of vaccine information, being able to answer patients' questions, clarify myths, and help build confidence in the vaccine. So their role of advocacy is very critical. If you're wondering why those with chronic conditions, why are they too prioritized? Well, comorbidity plays a significant role in this pandemic. And those who are diagnosed with diabetes, hypertension, and the other conditions are at high risk of being infected and having severe manifestations of the disease. These underlying conditions already are a compromise to the immune system or the body's ability to respond to any virus, inclusive of the COVID-19 virus. As such, it is seen as a priority group to minimize, again, morbidity and mortality as a consequence of the virus. In effect, we are reminded that priority to save lives, that is the priority, and the first deployment of vaccines must go to the most vulnerable to avoid, again, severe forms of illnesses, to prevent hospitalization and death, and of course, reducing the strain on our already stretched health system. Another area I wish to expand on a bit is planning and coordination. To oversee the entire process of planning and coordination, 3 teams have been established. We have the COVID-19 National Task Force, which is at a higher administrative level, the Immunization Technical Committee, and of course the Technical Working Group on the ground, who all have their specific functions and responsibilities. With the exception that we may receive vaccines, well, Prime Minister just announced by tomorrow, logistics are in place as it relates to receiving the vaccine at the Douglas Charles Airport, as was mentioned, where it will be transported directly to our central medical stores and subsequently distributed to the various health centers on island, health facilities on island, that is. Over 27 refrigeration units have been purchased to facilitate adequate storage in the first instant. The actual rollout of the vaccines will be done at the primary healthcare level, as was mentioned, and is done for our regular immunization program. As such, primary healthcare teams have developed their respective implementation plans across all 7 health districts. It is expected that an average of 5 teams of vaccination stations will be set up at the same facility. In this case, the type 3 health facilities, administering vaccines to an average of 300 to 400 persons per day. The vaccine rollout team will comprise of 3 subcategories, namely a vaccine admin team, a purely clinical team, and a monitoring team, all with specific functions. Of course, there will be the data entry personnel, ushers, and security for a timely and orderly service. Commencement dates will be announced to the public. Vaccines will be administered free of charge to clients on a voluntary basis, again, as was mentioned. Proof of vaccination will be documented on a special COVID-19 vaccination card, and post-vaccination surveillance and monitoring will also be in place. Finally, a comprehensive communication and information strategy has been developed through a series of ongoing consultations with the aim of providing accurate information to the public to encourage the uptake of the vaccines. The Ministry of Health is cognizant of the myths, misconceptions, and misinformation among some in the public domain. It is not surprising, as there are always concerns expressed with new medication or treatment. Nonetheless, any hesitancy should lead to thorough review of the applications, the risks, benefits, and alternatives, with a view to making an informed decision that can positively impact on your health and that of your families and, of course, the wider community. Hence, this campaign will create the avenue for dialogue and respond to individual concerns, sensitizing and engaging the public at different opportunities and settings. Of course, the role of the media cannot be underemphasized, partnering with the Ministry of Health for the long haul, which is the duration of this pandemic. Despite the immediate plans to secure the vaccine, it is rather fitting to remind you that vaccines alone cannot be the answer to ending this pandemic, especially with the anxieties of wanting to return to a measure of normalcy. Hence, the public is kindly reminded to adhere to all the established protocols and social and public health measures, which must be continued before and after vaccination, and to avoid prematurely declaring victory over the pandemic. Similarly, for us in health system preparedness must continue with contact tracing, case identification, quarantine readiness, swabbing and testing, personal protective equipment procurement, and the likes post-vaccination. To effectively stop the spread, it is expected that the more of us that get vaccinated, the faster we can curb the spread and replication of the virus. Dr. Carissa Etienne puts it best by saying, "No country is protected until all have access and is protected, and we will get to the end of the tunnel, but only if we do so together." In conclusion, I hope that you can appreciate the processes and overall strategy for the implementation of the COVID-19 vaccine in Dominica, bearing in mind that we are always guided by scientific evidence, as well as the technical support provided by our regional and international health counterparts, who we are very grateful for. On this note, I wish to end by extending gratitude to the staff of the Ministry of Health under the auspices of the Minister for Health, who have worked tirelessly on this plan and rollout, some who are here in the audience behind me, and others at their workstations who will be further engaged in various aspects of the actual implementation. And finally, we can't undertake a rollout of a vaccine without the continued support of the public. So we look to your continued cooperation in yet another strategy of confronting this most dreaded COVID pandemic. Thank you.
All right, thank you so much to the Acting Chief Medical Officer, Dr. Laura Esprit. And as promised, we're going to open the floor for some questions, but there were a couple posed previously, so we're going to try our best to answer those questions first, and then any additional questions you may pose, and we will direct them to the appropriate head of department. So if there were two questions that I think that can be combined, post-vaccine protocols for coming into the country, that's one of them. Do people still need to have PCR tests done or be quarantined? And also those who are already quarantined, should they be receiving the vaccine? So, Dr. Ahmed, can I trust you with that question? Sure. Okay.
Good morning, everyone. So the first question is, if people at the St. James or active cases can be vaccinated. Am I right? That's the question? Right. So this is not mandatory. In terms of the science, they are eligible. They are eligible to accept the COVID vaccine. There is no contraindication. Although we do know if someone has COVID infection, it will give at least 90 days of immunity, which is not proven, but it has 90 days. So one can delay the process of getting vaccinated for that period of time. But there is no contraindication as to taking the vaccine and those who are infected by COVID infection. So I hope that answers your questions, right? The second one was, sorry.
Those who have received the vaccine already and they're coming in, do they still have to take the PCR or be quarantined?
Right. To short answer to that, yes. They still have to do the PCR testing. PAHO WHO, as we are guided by their guidance, so there is no switch in terms of in terms of our protocols, in terms of our taking this PCR testing, there is no change in that. Mainly because we have not received the herd immunity. That's the most important part. At that point, we can decide as to whether we should stop testing people. Until that point, we would not know for sure if the immunity level, how long, and the extent of it. So we continue to monitor with the PCR testing. So this is important at this time. We are discussing on a weekly basis on that matter. Any scientific literature that is out there, we are going through it. We are in contact or in touch with PAHO WHO in terms of if there is any development in this regard.
This is actually a two-part question. The first question was to Dr. Ahmed, the second one to you because those are Dr. Submitted, and he said there were two phases because of time when we discussed one, and he said that is what the reference the second one was to. The first one to you, Dr. Ahmed, again, congratulations on the group you guys have been doing. In terms of AstraZeneca, I've noticed that India and UK have been discussing having combined vaccines and having a vaccine combination with AstraZeneca and other things for the new strain as well. Are we to receive those vaccines that can come for the new strain that is coming from Africa? And that is the first part. And then the second question to Ms. Esprit, we spoke about a lot. I love the way you articulated it, put it together. And also deals with the section of your bringing out program, or you speak to people, or in terms of having video programming, those who can see, those who are deaf and blind as well, are we going to have videos that could explain to them those things?
Okay, answer to your first question would be the vaccine that we are getting it. This is the same type of vaccine that is Oxford AstraZeneca first developed. So the India actually manufactured the same technology using this exact technology of Oxford AstraZeneca, and they are distributing to the world. So the Oxford AstraZeneca actually gave them the permission to produce in their company, a company named SII, and distribute globally. So this is the same Oxford AstraZeneca vaccine that we are getting, but it's a company from India.
Okay, although you said Dr. Esprit, perhaps it would be best directed to the coordinator of the health promotion unit with regards to the sensitization program.
Good morning, everyone. Mrs. Schlingford, Coordinator of Health Promotion. And of course, as we mentioned, as part of our implementation team, we have also established a communication committee, and we will be using a wide range of activities for information sharing. So one of the first activities we will commence with is, of course, empowering and training our healthcare workers. We have already selected dates for that. It will happen as soon as from tomorrow. So we'll be educating and informing and advocating with all of our healthcare providers for 3 days, Tuesday, Wednesday, Thursday. From that, and somewhat simultaneously, we'll begin information and educating the public. And we'll be doing that through many mediums. So we'll be using animations, we'll be on the radio discussion, all of the different radio outlets, and we'll have the public have the opportunity to call in and ask questions. The team that you see behind of me form part of the communication team, and all of them are critical in different subject matters. So for instance, we have the EPI manager who's responsible for vaccines. We have the director of primary healthcare for implementation and rollout. We have the medical director. We have lab, who will speak in terms of the need for continuous testing of PCR persons, even if they have taken COVID vaccine. So these persons will be the face of the implementation and information section of the COVID vaccine. So we'll be doing animated videos, we're doing PSAs, and of course, we have always thought of our persons with disabilities. So we will be sending out information also in sign language as we have done before. So we want to just assure you and assure the public that we will not leave any stone unturned in sending out information and education to the public. Mm-hmm.
Go ahead, Ashley.
Good morning. Questions? No. So the vaccines are coming in tomorrow, Tuesday, 9th of February. Is there any day or dates to actually start vaccinating people of Dominica? Secondly, do you have a daily target in terms of vaccinations? How many numbers you have to see per day being vaccinated? Also, are there guys in the care homes, the elderly, do you have a special plan in place to reach to them or to go into the homes to administer the vaccines to them? And just some information on in terms of the AstraZeneca vaccine, just a clarification. Could you just let us know the shelf life of that vaccine? Also, how prepared are we in terms of the capacity storage of the 70,000 doses? And given concerns over its efficacy against new variants of the COVID-19, are you concerned as well? Do you share the similar concerns about the efficacy of AstraZeneca against the new variants of the COVID-19?
Okay, so quite a few questions. I think some of them may have been addressed as well in Dr. Espri's presentation, but perhaps Dr. Espri, you can come and reiterate a few of those, including, the target audiences and start date and so forth.
So I tried taking a few notes, so you may have to reiterate some of the questions, though. But in terms of our start date, bear in mind that we wanted to do some training. I think Mrs. Shillingford mentioned the training. That is very, very critical. It cannot be underemphasized here. So very likely within, I would say, approximately a week to a week and a half, we're hoping to start the process. But of course, the media will be informed in a timely manner, so that the public can actually get the information. Bearing in mind, too, that the communication strategy will begin, I think, as soon as tomorrow, and will and continue even after the vaccination process has begun, so to speak. All right, in terms of daily target, it took us a lot of maths to come up with the figures, but we're looking at approximately 300 to 400 persons per day. But please bear in mind there are varied circumstances. On an individual level, there are certain things that is concerning from a health standpoint, but on average, we're looking at 300 to 400 persons. In terms of the elderly homes, essentially that's where some of our elderlies are. So that would be incorporated. Of course, we would have to liaise with the management of the elderly homes. All right. In terms of, so Dr. Amin, I can take the vaccines. Thank you.
So there are two other questions, the shelf life of the vaccines and the efficacy against the new variants, right? All right. All right, so Dr. Amin.
Okay, the first question is the shelf life, right? We have not received the vaccine yet, so today is arriving. Tomorrow it is arriving here. So once it arrives, we will know what is the shelf life of these vaccines. Second question was efficacy. Yes, AstraZeneca has, it says 60-some%, 62 or 63% efficacy as compared to the Pfizer and Moderna. This is just one study. In another study, the efficacy of AstraZeneca, the trial conducted in UK that had 90% efficacy. There was discrepancy in terms of the dosage. So with a different dosage, they got the efficacy much higher. So on average, it is over 70% of efficacy. To be honest with you, any vaccine over 60%, it hits the benchmark. Any vaccine previously, measles, mumps, rubella, they all had the same benchmark, not 100%, not 90% even. So with this in mind, AstraZeneca is the for us, only option at this time to really to embark on. I mean, Pfizer requires minus 70 degrees centigrade. That capacity, that's really only few countries can go ahead and implement that. In terms of Moderna, it's not available outside of United States, and it is not one of those COVAX facility vaccine as yet. So AstraZeneca actually is a COVAX facility vaccine, and it is available to globally, and we are in better position to really implement this and get this vaccine done in our country. I just want to expand on this matter is that we have a window period that we don't have the community transmission, unlike other sister countries. So this is important that we use this time and implement this AstraZeneca vaccine before God knows if anything happens. So we all should actually get on board and see if we can reach the herd immunity as early as possible. At this time, as you know, we have 35,000, and we may get another 20% of the population. That will bring us over 50% of the population covered. So with this, I'll stop here.
Unless somebody has another question for you.
Just one question, and that is really administering of the vaccine. Will there be any forms being signed and protocols in place that says in the event that something happens to me, that I don't sue the ministry?
Well, it's a good question. Short answer to that, yes, there will be a consent form. There will be a consent form that every vaccine taker has to agree to it. That's one. Secondly, very importantly, that we will be following up every single vaccine taker in Dominica before and after. So we have the electronic platform in process of finalization that where they will register. Every single of them will be registered before they take the vaccine. And in that process, there is a short questionnaire where we will assess those clients with regards to their chronic conditions or comorbid conditions. So this will give our healthcare workers heads up as to the preparation and necessary steps they need to do. Following up with those who will take the vaccine, we'll have the information electronically available to call up for second dose. We will also monitor those who may develop, not necessarily they will develop, may develop some side effects, and we will document these. So these will be all available online for our healthcare workers.
My final question. We know that you're putting teams to help assist the administration of the vaccine. Are those going to be solely health professionals, or are you going to have volunteers in?
Well,
All right, so we'll direct that to the Director of Primary Healthcare Services, Dr. Gilda Nestital.
Hello, everyone. Like the moderator introduced me, I'm Dr. Nesty. To answer your question, when it comes to the administration of the vaccine, the actual administration, that will be limited strictly to health staff, health personnel. So you can be rest assured it is persons that are comfortable and who are competent in vaccine administration. Okay. Administration.
So you won't have any kind of volunteers in the process?
In the process, yes, but for administration, only health professionals. Implementation of the plan is a different question. There we will incorporate the help of other volunteers. Okay.
I'm not sure, but did someone say that it was going to be administered at the primary health level, meaning the health centers, the health districts?
That is correct.
So then my question would be, because, I mean, for me, I think that at the health centers, we're already short-staffed and dealing with, are we going to have new hirees or so on to help with the administration of vaccine, especially if we say 300 to 400, that's our estimation. Is that in the plan?
Yes, it is in the plan. Now, primary health care is an aspect of the Ministry of Health that works together. So we will be working with other health, other nurses, doctors from the different districts. We will be administering the vaccine in a particular district at a particular time. So each district will not be administering at the same time, so we can lend the support of other healthcare professionals in the different districts.
I also have a concern because I remember when we were going to roll out the vaccine for the cervix. HPV. Yes, that one. We had already, we had done our education sessions way in advance. And I'm thinking if the vaccines are going to be here tomorrow, then why are we so late in our, because I know there are a lot of questions, because I remember watching Dr. Fauci, and even in his deliberations, there are still a lot of questions. So why are we so late in our education program?
So yes, we're not late, neither are we unprepared. We are actually on the ball. We've started a lot of discussions in terms of preparation for delivering education, re the vaccines. However, the time in which the vaccine arrived on island is new to us, correct? And so we are ready right now to push forth all of what we have prepared for this implementation of the vaccine administration. Okay?
My final question is, what exactly does the vaccine do?
Okay, to put it simply, the vaccine allows your immune system to be strengthened so that it can recognize the COVID-19 virus in the event that you're exposed to it, and also protect you from disease. Strengthened meaning you will have adequate antibodies in your system. You would have recognized the virus already, so that if you actually are in a situation where you're exposed to the actual COVID-19 virus, you also have memory cells and antibodies ready to defend your body from the disease. You're welcome. Is that it for me? Yeah.
Any other questions for any of the heads of department? Of course. Thank you, Dr. Nesty.
Thank you very much.
Of course, as we mentioned, this is only the beginning of our sensitization program. There will be other opportunities to post questions, and you are the voice of the public. It is your responsibility as media practitioners to voice their concerns and, alleviate any anxieties that they may have about this vaccine. So we invite you whenever these opportunities come up to join us and, pose the questions, ask the tough questions, because that's what you're the ears on the ground. You know what people are concerned about. So we invite you to ask the questions. Again, this is just the beginning of the sensitization. Like Dr. Nesty mentioned, the arrival of the vaccine was fast-tracked because we expected that it would happen perhaps in March. And we're just at the beginning of February. But thanks to the government of India, through the Prime Minister and the government of Dominica, we were able to get these vaccines, these doses, earlier than we had initially planned. So like she said, it's not that we're late with the sensitization. However, we have begun. So we encourage you to avail yourselves of the opportunities to pose the questions and to help out the general public and help convince them to take this vaccine. All right? Again, it's not mandatory, but it serves in the best interest of the country for us to do that. Let me thank all those who made the time to come through this morning. Thank you so much to all the heads of department. Thank you to the acting minister, Honorable Kent Edwards. Thank you to the acting chief medical officer, to our permanent secretary, who you may not see all the time, but trust me, PS has been working tirelessly. So we want to thank her for taking the time to come to attend this press briefing. And thank you, of course, to the principal nursing officer, Terry Ravalier. Thank you, media partners, for joining us this morning. And we wish everyone, the listening and viewing public, a good Monday. Thank you very much.